welcome to Something to Talk About. I'm Linda McNamee, and for the next hour we are going to find out new ways, or a particular new way of parents to get involved in their child's education. You'll hear more about that in one moment, but as usual, I would like to thank you for tuning in this evening. If you have a question for our wonderful guests, whom you will meet momentarily, you can always give us a call at 781-270-9199. Sorry, I never call. I'm here. Or if you think of a question later on or have a suggestion for a future topic, I love to get emails, so please email me at talk@bcattv.org. And I would like to thank my wonderful crew for this evening. We have Chris Flaherty, who came in like a superhero, as he always does. Chris, I love you there, buddy. Chris is Director Extraordinaire in for the infamous or the famous Colleen Moore, who cannot be with us this evening. We also have Jolie Atwood and Stephanie, and I forgot Stephanie's last name, so sorry, Stephanie, but thank you for coming in this evening. And we also have Mike Duvall, who is a staff member here, making sure that everything stays up and running. Definitely last but not least, I would like to thank my husband Paul for staying home for Daddy Date Night. Hopefully the kids are cooperating with you, so thank you very much. And now I would like to introduce my wonderful guests. We have Marilyn Belmonte or Belmonte? Belmonte. I knew I forgot something before we started the show tonight.
Okay.
And we have Lisa Arsenault. And you two are, thank you very much for coming in.
Yeah,
and
thank you for having me.
Thank you.
Thank you for your ambitiousness. Is that a word? Thank you for starting this wonderful new parent group that I can't wait to hear all about it. It's called Burlington Parents Stand Together.
Correct.
Yeah.
Okay. Now, before we begin, because I know we're really excited about that, could you guys tell me a little bit about yourselves, how you came to the Burlington area, if you did grow up around here, where you grew up, how you came here, and how you decided to get involved in a community organization, and then we can talk about what community organization it is.
Sure. Thank
Who
you.
wants to go first?
I'll go first. Well, I've been living in Burlington for about 28 years and raised my children through the Burlington school system, and successfully. Everything's gone very well, and I really have enjoyed living here in Burlington. And originally from Winchester, and I wanted to become involved in community issues related to teen risky behaviors like drugs and alcohol.
Okay.
And that occurred about the time that my oldest daughter was 13.
Okay.
So that was many years ago. And so I became involved with the Burlington Drug and Alcohol Task Force.
Was that always like teenage years, or did you start with like the younger grades?
I really, like most parents, didn't really give much thought to drugs and alcohol until she started to go to the mall on Friday nights and go to the movies with her friends. And then you start, a lot of parents, I think, really then they start to focus on some of the different issues suddenly that they just weren't thinking about before.
Is it typical teenage behavior, or is there something else going on?
Right,
Oh,
yeah.
okay.
So, things start to change, and then I started becoming interested in that, and I volunteered with the local coalition and became the co-chair for 13 years.
Wow.
So that's my background to this.
I, on the other hand, am the newcomer. I moved to Burlington 4.5 years ago.
Okay.
We moved here shortly before my youngest was born.
Okay.
And I had just finished school a couple years before that. I was getting my PhD in nutritional epidemiology.
Oh, wow.
So I was studying nutrition.
I might need to talk to you about something else afterwards.
I could do another show about that. So I studied nutrition science, and nutritional epidemiology, which is the study of how food and nutrients relate to health risk and chronic disease. But as I graduated, it was, there wasn't a lot of jobs in that content area necessarily. And my
Really?
interest-
What a surprise.
and over the years, my interest had really grown to be more
Okay.
broadly public health. So I was
Okay.
lucky enough to find a position at an organization called the Institute for Community Health. And
Okay.
so I got a job there right after I graduated with my degree. And
Okay.
since then, I've been working in public health and doing community-based research and in a variety of topic areas. We moved to Burlington, and with little kids, it's really hard to get involved in the community,
Yeah.
volunteering. But, you know, in the back of my head, I always had that. I wanted to get involved. I wanted to be part of the community and figure out a way to do that. And finally, you know, my youngest turned 4, and I started really thinking, I could go do something now. And the results of the 2014 YRBS survey had been released this past fall.
We'll get into more detail.
We'll get into
I was
that.
gonna say, is that the
But that
survey
was the
that?
spark.
Okay.
Put a pin on that, yeah.
That was the spark. That
It's on my cheat sheet.
Yes, it is. That was kind of the spark, though, that got me like, this is what I could do. This is what I can do in Burlington.
So did your older child get the survey?
No, she's
No,
only a
she's
3rd
still young.
grader.
Okay, I wasn't
So,
sure
yeah.
what the. Okay, we're gonna get to that later.
Yeah,
I'll
right,
just
we'll get
shut
to
up
that.
now.
No, that's okay.
But
That's a good question.
the idea, the topic area of substance
Okay.
use among youth is something that I've done at work and professionally.
Oh, okay.
So just seeing that it is an important issue within Burlington, I realized that, well, this could be my opportunity to really do something in
Yeah.
the place that I live.
And it's a new organization,
Yeah.
so getting in the ground up, you can use your education to kind of morph it or mold it in
Right.
how you want.
Right. Right.
And I can, you know, feel like my knowledge and what I've learned over the past
Okay.
7 years doing this type of work,
Right.
I can actually do something in the community that I live in. And for my kids who are young and going to be growing up in Burlington for many years.
Excellent.
Right.
So how did you decide to do Burlington Parents Stand Together?
Well, I had been, I retired from the Burlington Drug and Alcohol Task Force.
Okay, is that
which
still around?
Is,
Or did it just kind
well,
of?
it's kind of fizzled out. The coalition, by definition, a coalition is when there are representatives from every sector of the community, police, schools, health
Okay.
department, et cetera, all coming together, including parents and students coming together and meeting to discuss issues and problems of the day and how we can prevent them and some solutions and
Okay.
that sort of thing. It's very important to have some
A good
kind
representation.
of function like that because if you have one person in a community that's spearheading, say, wonderful prevention programs, they can be great. But when that person leaves the town and takes a job in another community, so goes the programs. You
Yeah.
can't guarantee that someone else is going to step up and fill those very big
Right.
shoes.
Right.
So having a group like that really helps for sustainability, so
Okay.
that not only are you making changes, but you're going to be able to continue to make those changes.
So it's
for
not
a
just
great-
one person who knows
Right.
everything. There's
Right, exactly. So anyway, when I retired, when my youngest graduated from Burlington High School in
Okay.
2014, I just had that in mind that I would retire, and I still wanted to be involved with the task force.
Okay.
But I wanted to step down and let someone else take the helm and fresh new ideas kind of thing. And they haven't had any meetings since I retired June 2014.
Okay.
So now Lisa wanted to get involved, and she's trying to find some way of getting involved
Okay.
and found me.
Yep.
She
I
hunted
found
you
this
down.
great website with all this content about the task force, and everything ended like in 2013, 2014. There were no new
Right.
posts. And I didn't know what to make of that. And I tried to track down who worked on it,
Okay.
who did the survey, who does this type of coalition work in Burlington. And everything pointed to Marilyn.
Found you. Tag,
Yep.
you're it.
Right.
Yep.
So she contacted me, and we got
Yep.
together to have a discussion about what the community has done over the past few decades regarding drugs and alcohol, and now what? And we realized that there was now this hole, this space, and you know, we realized that there are a lot of parents in the community that they're always still calling me or emailing me saying, we have this problem, Marilyn, you have to get on this problem. And that was fine when I was, you know, chairing the task force, but I'm like, well, I'm kind of retired now, and I realized that, you know, the problems aren't going away, and the concerns, parent concerns are not going away.
And there's nobody there to answer or address their concerns.
Right, what are we going to do about this? This is not good. So we decided, fine, we'll put together a parent program, a parent group that would perhaps come up with some ideas and events and programs specifically to educate parents, raise awareness, and help parents raising healthy kids, healthy teens, and at some point, maybe later down the road, maybe even helping with policy changes and things like that. But right now, we're thinking really dealing directly with parents and working with the schools. So we want to try to partner with the schools, and hopefully the task force will resurrect, and you know, the police department and other sectors of the community as well.
So you're planting a new seed, hoping that it will bloom.
Yeah, we'll see what happens.
So, is there really a problem or a big problem in Burlington where drug and alcohol use and abuse needs to be addressed, or is it just parents concerned that, you know, the stereotypical kids will be kids?
Well, there's a problem everywhere. First of all, I don't want anyone to think that Burlington is unusual. The problem is that Burlington is usual. A lot of people think that drugs happen someplace else, another type of community, maybe urban communities, not our quiet little town kind of thing. And parents have to realize that drugs are everywhere. Drug and alcohol issues with teens are everywhere, and so you have to make yourself aware of what is going on, educate yourself, and one of the ways that we do that is by surveying the high school students. So we mentioned the YRBS, which stands for Youth Risk Behavior Survey.
So you surveyed the students or the parents of those students?
We had a survey of our own for parents, just to get some idea about their concerns, which we'll talk about too.
All right, so let's start with the youth survey.
Okay.
Yeah. The youth
Why don't you
survey.
explain that?
Yep, the youth survey is conducted in the high school.
Okay.
And many
Paper survey or electronic?
It varies school district to school district. I believe it's a paper-based survey here in Burlington now.
Okay, so it wasn't just Burlington.
No, many local school districts conduct their own survey. The state does it. The CDC runs a national youth risk behavior survey. And they've been in place, they've been in practice for decades now, and it's really the best surveillance mechanism to figure out what's going on.
I'm assuming it's anonymous.
It
Absolutely,
is.
yeah.
Completely anonymous.
Hi, my name
If anybody says that they're afraid that, you know, to answer to answer truthfully because someone's going to be able to figure out who they are, you're just filling in little circles. There's no writing. There's no handwriting to try to decipher or anything like that. You're just filling in little circles. So
practice for the SATs.
Yeah, exactly. It's something similar to that.
Okay.
But these surveys really are the best way to get a sense of what kids are doing in high schools. And so it is our best source of data, our best source of information to know whether there is a growing problem. You look at the data over time and you can see trends popping up.
That's what's really important. Excuse me. This is what's really important. This isn't something that you just do once and say, okay, here's our data. It's something that the CDC does on a federal level, national level, every 2 years. The states do it every 2 years. And so communities are encouraged to do it every 2 years. So now you're going to see patterns. You're going to see trends. You're going to be able to see, for example, if you see a particular issue coming up, then let's design some programs to deal with that particular issue. And now you can watch and see if those programs are working, because hopefully you're going to be seeing those numbers go down.
2 years'
so
time.
It's really important to have a vehicle in place to judge what you're doing, what the community's doing, and whether or not it's working. It's huge. It's very important. And the federal government will, they have lots of funding, lots of grant money that hinges on these types of things. If you don't have a mechanism for measurement, a measurement tool in place, you know, you can't get funding to help with a lot of these issues. So, you know, it was very important to get that done, to get this done.
Now, the survey that you use, is it something that is provided by either the federal or the state government, so you don't have to come up with the questions and you know how to phrase things and what to look for and how to score?
There is a basic survey that is put out by the CDC.
Okay.
The Centers for Disease Control and Prevention. But yes, we have a lot of communities will tweak it a little bit if there's something in particular that they're interested in. The task force, Charlie, my co-chair, and I had applied for a grant, a local grant, Chenal grant, to administer the 2012 YRBS. Okay, it had not been done in over a decade.
Wow.
Here in Burlington.
Okay.
So we wanted to get
that.
We wanted to resurrect that. We wanted to get that going again. So we applied for some grant money and got that done. And we did change some of the questions. For example, there was no question on prescription drug use in the CDC version, and we said, well, that's really important. We need that.
Yeah.
And of course, it's not just about drugs and alcohol. It's also about healthy eating habits. It's about sleep habits. You know, how many hours a day are you sitting in front of electronics versus exercising?
All of this is included in
So right, so
wow.
there's a
Depression
wide,
and suicidality.
Sure. How often have you thought about depression over the past, you know, or suicide over the past year? Lots of different questions.
Wow.
Self-esteem, self-image.
How long is the survey?
It's 100 questions. Usually they
Wow.
keep it around 100 questions.
Yes.
Okay.
So yeah.
Covers a lot of ground.
Yeah, it does. It covers
does,
a
yeah.
lot of ground, so we can really get a really good picture on the health.
And I'm guessing you're getting the support from the school to
Yes, you have
administer.
to.
Yeah.
Obviously, you can't go into the school and do the survey.
Here, fill this
without-
out, yeah.
Right, it's very important to be working with the school. So we did that in 2012, and then it was repeated in 2014, and it will be repeated again, I believe, March?
I believe so, yeah.
In next
Soon.
month,
Yeah.
in March of
Okay.
2016. So again, it's done every 2 years. So we will see.
And then once the data is collected, what do you guys do with that information?
Well, we don't have the
Yeah,
data
okay.
ourselves. The school
okay.
district conducts the survey. They're in charge of the data, and they disseminate
You
the
hire
results.
someone
Okay.
to
Evaluate.
evaluate it.
Yeah. Okay.
So this
Exactly.
way, it's
Yeah.
you know, an independent person does the evaluation of the survey and gives us a report. In 2012, being part of the task force, we did have a copy of that report. I did as a co-chair of the task force, and then in 2014. Parts of the survey was discussed at the school committee meeting so that parents could hear about some of the good and the
Issues.
bad. I mean,
Okay.
you know, there's always positive and there's always
Yep.
negative. So one of the negatives you might want to...
Yeah, it was my viewing of that school committee meeting in, I think it was September, October this past fall, where they were presenting the results from the 2014 survey. And because of what I do professionally, I'm very familiar with YRBS data. I work with this data from other communities. And I have a good sense of what the numbers really mean. And so when I saw the results come up, specifically for heroin, lifetime heroin was 7% of the high school students at Burlington High School.
What does
was-
lifetime mean?
That they've ever used it.
Have
at
you
least
ever in
once
your
a
lifetime?
year.
Ever, okay.
Yeah.
As
Okay.
opposed to what we call current use, it would be worded over the last 30 days.
Yeah.
Have you ever used?
Okay.
So
wanna
anyone
get sure, like,
ever,
yeah,
even, so
okay.
even if someone used it once and said,
Once.
boy, I really hate this, I would never use
Yeah.
this again, they would say yes to
Yeah.
that question,
Okay.
to the lifetime
Yeah.
question.
So it's not distinguishing addictive
Constant.
But it's
behaviors from just
still pretty high,
Right,
I would
exactly.
think.
And I knew for a fact that 7% was the highest number I had encountered
Wow.
in
Okay.
looking at
It
YRBS
was
data.
2 point something in 2012.
there
So
was
it
quite a
had jumped.
It had jumped
spiked.
that. Oh,
Yeah.
wow. That's huge.
Right.
Yeah.
It had spiked.
Okay.
So of course
and
that's
that
concerning.
was really the spark that got me going.
Now, had you seen the 2012 data knowing that there was a 5% jump?
I mean, it was brought up and the trend was
Okay.
mentioned as part of that presentation.
Okay.
So the jump and just the number being 7%, which is
But if you look at
extraordinarily high.
if you look at the state numbers, and when I say state numbers, what that means is the state will randomly every 2 years choose a variety of communities, and they will just take like maybe 150 to 100 students
Okay.
in, say, some rural communities, some urban communities, some
So like
suburban
a
communities.
cross-section type.
Right,
Okay.
exactly. And then they put that all together, and there's your state numbers. You don't know specifically which towns they're coming from, but there's just to get you an idea.
And the average.
And so looking at that and looking at other local communities, so surrounding communities, 7% was higher than everybody.
Yep.
So, of course,
Okay.
parents are calling me on the phone going, "Oh my gosh, what's going on?"
Marilyn.
Well, Marilyn,
coming out of retirement.
Something else for you to fix. You know, and you know, so I said, well, okay, now let's not go too crazy. We do want to do this again in 2 years. We want to see this could be an anomaly or it could be a trend, and we won't know that really until we see the 2016 data.
Okay,
But-
now you had mentioned that the 2014 data wasn't publicized until a year and a half later. Are you going to have to wait that long for the 2016?
No, I don't think it shouldn't take a year and a half. It shouldn't take a year
almost
and a half.
time for the
But
next
it
survey.
takes, you know, it takes
Yeah.
quite a few
Yeah.
months for someone to crunch all these numbers and to come up with. This is a big report with lots of charts and graphs and pie graphs and all that stuff.
Oh, you can
It's-
manipulate data to tell you anything you want.
you know,
To
so
be
you know,
fair, the state YRBS data
It takes-
only has the 2013 release. They don't have
Right.
Okay.
the 2015 yet.
Oh, yeah,
so
it takes-
it can
Okay.
take a
it
while.
can take a long time
Okay.
for that to come
Yeah.
out. And then what the community does, what often happens is now the school committee is going to show this, let's show this to the superintendent, let's show this to the chief of police, let's show this to certain key people in the community first, have a discussion, and then, you know, then everyone's going to have their discussions before they publicize it
Okay.
to the entire community. So
Okay.
that's why I think it takes a really long
Yeah.
time.
Yeah.
It does.
But from the parents' perspective, you know,
Right.
our goal is really to navigate our kids through life so they can be
Okay.
prepared for whatever they're
course.
going to encounter. It's really challenging to do that when you don't know what problems lay ahead.
Okay.
So when parents aren't as aware that these surveys are being conducted or that there are
Yeah, I didn't
red
know surveys
flags
could-
that are
yeah.
coming up from the
Right.
results, if parents in
Right.
Burlington aren't aware, it's really hard to
Right.
to help support your kids when you're sending
Right,
them
right.
to school, to
Right.
know how to handle the situations if their peers are talking
Right.
about heroin or
Right.
if they're offered a prescription drug, you know. So
Or like around Halloween time, there were all these pictures on like Facebook and everything
Oh,
about.
Those come
you know,
out
these-
every year. And
Are they
I
like
get
valid or is it
so
just like
ma-
urban
well,
legends or?
They are,
I
but
don't
they're
know.
generally regional. It doesn't mean that it's happening here. So I always get the
on the
crazy
internet, it's gotta be true.
right.
Yeah.
No.
That was supposed. You were supposed to sense sarcasm.
Right,
in that.
right,
Okay.
exactly. Right. I would always get emails from parents that were panic stricken about something that they had just seen or read or passed from friends, and you have to realize that there are things that are occurring in different parts of the country, that different drugs and looking different
Okay.
ways, and so. But this is heroin is just it's an issue that's been going on for a long time in New England.
Okay.
Huge problem. Basically, what we want to do, we want to raise awareness with parents, because parents need to talk to their children about the proper use and abuse of medications.
Okay. Now you're saying
And-
medications, so it's
Well, all medications
Okay.
would be the best.
Yeah, ideally.
Ideally, we want to. We absolutely. Parents aren't aware of that. Parents just have no concept that using something in the medicine cabinet is going to lead to heroin use or some other drug use like that, illegal drug use. But there is a very strong connection. The prescription painkillers that have been prescribed by doctors for our children for athletic injuries and surgeries, and even for young adults, wisdom teeth removal. I mean, I could go on and on. It's just so scary that these prescription medications are synthetic heroin, in essence. I mean, not exactly, but to the brain, it's the same thing. So Vicodin, Percocet, you know, right? It's the same drug category. It affects the brain in the same way. So,
now, is it just prescription meds that parents need to be concerned about, or is it
are
just
all
like over-the-counter stuff,
well,
like cold
that's
medicines?
another.
And
Those are different drugs in different categories.
Yeah.
What we're really concerned right now with the heroin use, that we're sort of focusing on the prescription painkillers.
okay.
Because it's the entry point. The heroin
They're
is
gateway.
just kind of their gateway. Heroin is just kind of the end of the line.
Okay.
Once you're not trying heroin until you've already consumed alcohol, you've probably binged alcohol, you're smoking marijuana, and you're experimenting with prescription
With pills.
Right.
Okay.
Yeah.
Right.
Then the heroin comes up.
But parents are not going to talk to their kids about, don't take someone else's medication that they bring to school or bring on the bus, or somebody says, oh, you're stressed out, here, take this pill, it will help
have
you.
a Valium.
You know, right, it'll make you feel better, or even for that matter, which is really scary, is saying hell no to a doctor who wants to prescribe these medications because your son or daughter has been injured. No, can we use Tylenol or Advil or some kind of over-the-counter pain medication? I don't want opiates for my child, because doctors have been over-prescribing them for a long time. And it's still occurring. You know, 10 years ago, okay, we can say that doctors were not aware of the connection. But they are now, and there's absolutely no excuse. There's no excuse for this. So parents need to take an active role when it comes to this, and say to the doctors, well, I don't know if I want my son to have Vicodin. Does he have to have Vicodin? Why can't we use Tylenol? Can we try Tylenol first? And
now, is Tylenol with codeine still one of those red flag danger? Because I remember
codeine is in that same drug family as Vicodin and Percocet and OxyContin.
Okay.
Yeah.
OxyContin was kind of.
But they're not
going,
using. See, they're really not using Tylenol with codeine anymore. Percocet and Vicodin sort of are the.
Okay, sorry, I'm going back to
the
when I had
newer-
wisdom teeth pulled out.
Exactly, I had
T3s,
T3s, right?
Right.
The T3s. They were the Tylenol with codeine.
Yeah.
And my oldest daughter had her wisdom teeth out, and she had a prescription in her hand when I picked her up with Vicodin, and I was like, oh, I really didn't want to. I was hoping to get there in time to tell the doctor I didn't want that, but. I said, okay, I filled it, and then I came home and I put the pill bottle in my bra and stuffed it in there to make a point, and said, let me know when you want it, you know, when you feel like you need one. And, you know, I got my point across, that she was not going to, you don't give this pill bottle to a 17, 18, 19-year-old kid and say, well, you're old enough to dose yourself. Oh, no. That's like handing a bottle of Jack Daniels to a teenager and say, but don't crack that seal. You can take this in your room. You know, hello, it's a temptation.
Hello.
Not in our generation. We didn't grow up with that kind of temptation, but that's what's going on now, is that prescription pills are being used. The kids are self-medicating, and that's what they're doing.
Now, is there still like an issue where, let's say I had some kind of condition and the doctor prescribed me Percocet or something, whatever's the drug
it would
of
be
choice.
for pain.
And,
they're pain medications.
You know, so let's say I had,
chronic
you
pain.
know, knee surgery or, you know, a leg that was, well, anyway, I was given the prescription.
Right.
Is there still a problem in our community where the child will go in the medicine cabinet and say, see what else is here. So even though it's not even though it's not my child's prescription.
Yes. Oh yes, the kids, there were all kinds of names for their little trail mix parties.
So they still do trail mix parties.
Yeah.
Well,
yeah. I mean, you know, the problem.
Yeah, do the kids know what these drugs
Even
are?
if
Or
you
is it
are,
just
let
like,
me put it to you this way.
you know,
Okay,
let's
yeah,
find
you
out
have
what's
to
going to
raise
happen.
The internet, every pill has a number code on it. You look it up, and it'll tell you exactly what that pill will do.
And there are websites that
and
will
how it'll
tell
make you feel.
kids, right?
Yeah.
If you want to get, you know, you want to get the feeling of cocaine or meth, which is stimulant drugs, you want to use Adderall and Ritalin, you know, kind of thing. This is the type of crap that they're learning on the internet. So parents have to have discussions with our kids saying, look, this is not a legal or safe alternative, which is what the kids are thinking. It's medicine.
Well, the doctor
When
told me
I
to
get
take it, it's going to be
sick,
okay.
Right. When I get
It's
sick, I
safe,
go to the
right.
doctor. Doctor gives me medicine. I get better. Ta-da! So how can this be dangerous? Kids don't understand. These are controlled substances. If this was not dangerous, you could go to CVS and just pick it right off the counter and buy it yourself. You need to go to a doctor. Why is this a controlled substance? Because it can be very dangerous. You need to have a doctor monitoring you, and you have to follow the dose exactly. And you don't share prescription medications. Doing any of those things
It is meant for you in this particular situation.
Right, and in this
Exactly.
dosage.
And you have to have,
you can't just say, well, today I'm going to take 3 pills instead of 1 pill or something like that. Any of that, that's drug abuse. So that is the same as where kids might say, oh, I would never do cocaine, I would never do heroin, that's not who I am. Well, if you're bumping up your dose or you're taking your mother's pain pills from the medicine cabinet and sharing them with your friends, that's drug abuse. That not only is extremely dangerous and addictive, but it is illegal. If something were to happen, you share medications, and something were to happen to a friend, they were to overdose, you could be charged with distribution of a controlled substance.
Wow.
But parents aren't having this conversation about the difference between proper use and abuse of medicines because they don't even know they need to.
Right.
How do we would even know if someone doesn't tell you that what's going on? So raising awareness and to get back to talking about these results with the YRBS, it is vital that every single parent know what they say. We need to know how to raise our children. We need to know what's out there. We need to know what kind of discussions to have.
Okay.
And if
So how do
we're
we figure
walking
that out?
around
Okay.
blind, then we can't do that. So this is all about.
So without an active coalition at this time in Burlington,
Yeah,
there
let's
really
get back to the
was-
coalition thing.
Yeah, there really is this void. There's no group concerned with informing parents and, you know, out there putting educational efforts for parents, targeting parents. No one's taking that charge right now. So that's really, you know, let's have parents do it ourselves. Let's come together. Let's build a network of parents who are interested in becoming more educated, learning better, more new skills.
Parenting skills. There are, because she's had a lot of I'm so happy to find her, public health background, which is great. I mean, I've taken courses, but I don't have the degrees, but I've taken a lot of courses because I wanted to educate myself when I was involved with the coalition. And, you know, there is so much that parents don't even know. There are actual skills and things that you can do that will reduce risk of your kids later when they get older, trying drugs, experimenting with alcohol. There are actually things that parents can do at different ages, different, you know, tailored to the specific age group.
Can we talk about some of those now, or do I have to attend one of your meetings? Okay, so
Marilyn has designed a whole parent education curriculum.
well, how do
her
we find
career,
out about that
so-
curriculum?
I have presented it here in Burlington. I did it twice here in Burlington, and I
Is
call
it like through the library or through the schools, or?
Well, I did it when I was asked to do it. The first time the chief of police, then Fran Hart, asked me to do it, and I did it at the police station. And then I also did again later on. The task force asked me to do a few years later. So, but it is a multi-evening parent education program that not only educates you about what's going on and what the issues are.
So when should you start ballpark talking to your kids about it? Like when they're
Elementary
in
school.
preschool, elementary school?
Absolutely.
Younger, when you've mentioned this before, you give your children vitamins.
Sure.
That's an opportunity to
talk about this is not candy. It looks like candy. It's a gummy bear.
I actually had a conversation with my child a couple of years ago. He's like, I want another gummy bear. It's like, no.
This
Your vitamin
looks
medicine.
like
One
candy.
a day.
Sometimes medicine looks like candy, tastes like candy. I mean, really, when you think about it, this is something I used to say with my program, which I think was really very instructional, very good. And that was that I would ask parents, because I'm dating myself a little bit, but back in the 50s and the 60s, when I would get sick, I had a fever, what medication would my mother give to me? And
whiskey.
There was only one.
That was for teething, right?
That was for teething, yeah.
No, but there was only one medication
can't sleep here.
for fever reducing for children. There was only one medication. It was St. Joseph's chewable baby
That's right. Orange
That's
flavor.
it. That's right. A little orange pill. And that's it.
Yeah.
That was the only choice my mother had. And now, look at the next generation.
I am intimidated when I go to CVS
our
and I'm staring going,
and their grape and their bubblegum flavor, and they look like pixie sticks.
dye,
and you
without
put them with a little
dye,
fizzy, and you put it on your tongue, and it bubbles like a pixie stick. And it's like there's gummy bears and bubblegum and
Sour Patch Kids and
yeah, but I mean, they're all the medications look like candy, and yet no one.
Because that's like
really
a double-edged sword, because you want it to be appealing so your kid will take it and get better, but the reverse side of that is
Yeah.
But what
it's
happens
yummy.
is now our children are not respecting medicine in the same way that we grew up respecting medicine, because it looks like candy. So by the time that they're old enough and somebody says, here, take this, or you're so stressed out, or whatever, you're depressed, or whatever, take this, and kids are self-medicating. They're not going to their parents and saying, I have a pain in my knee, or I'm feeling a little depressed and I don't know what to do, or gee, I can't focus on my work. I'm struggling, with maybe having ADD, and kids are just sharing their pills. Oh, my best friend has Ritalin, I'll just take that. You can't, parents don't even know that they even needed to have this conversation. They have no idea that kids are self-medicating.
The
we
irony,
don't want that.
The irony is that study after study after study show that parents have the biggest influence on the decisions their child will make as they grow up. You may not believe it if you have a teenager in the home. You're like, oh, this kid doesn't listen. I can only imagine what it's going to be like. But the truth is that they do, and parents
they listen, they just choose to ignore.
They look like they're not listening, but they are.
They are, and parents have to know that, and they have to leverage that, and have the consistent, frequent conversations, even if it's just 5 minutes in the car.
They're short. No, they have to be short. First of all, I always would say that they have to be short. Because if you're talking like we're having this lengthy conversation, would just
they'll tune out.
Exactly, 30 seconds and they've tuned out. So I always
my 7-year-old already does that.
I would always tell parents this has to be short and sweet. Maybe you've got a minute and a half in the car and you're picking up a bunch of kids to go to the soccer practice, and you only have a minute and a half between the time you get in and the time the next kid gets in the car. That's all you need. You want to keep it short and sweet, but it has to be frequent, because kids need to hear it over and over and over again. Pick up your socks off the floor. How many times do I have to tell you? Put your socks in the hamper. Think about it. How many
You've
times?
been in my house, haven't you?
No, I have 3 kids. This is what I'm saying. I know exactly how this works because I've lived it. I lived it, and I raised 3 children through adolescence, and I know how hard that is and how crazy it is, and parents think they're not listening anymore. They go in their room, they shut their door, they put their earphones on, they've got their technology that they're in, just tuning us out. And I would have, and I did a lot of these programs, by the way, not just for this community, but I traveled all around the state, over 100 communities doing my parent programs. And I would often have parents say to me, my son isn't listening to me anymore. I just really hope that what I've done up to this point will be enough. When he walks out that door, I just hope and pray it's enough. And I would say, and how old is your son? He's 13. I'd say, no, don't give up. Don't stop.
Don't stop.
You can't stop talking.
Don't stop.
That's what they want. They want permission to play. If you stop talking to them and stop having conversations, they think, Mom's not paying any attention anymore.
Yeah, Mom doesn't care what I do.
And, and when Mom doesn't care and Mom doesn't pay attention, you're giving them a ticket to ride. And they will take full advantage of it. But if you're always still having conversations, short, sweet, but frequent, and having...
Your voice will get inside their head.
Yeah, they know. Mom
when they're
is
confronted with it, they'll hear your voice.
Right,
They will.
right.
They will.
And Mom is up at night when I come home. Are you kidding?
Oh, so you lose sleep
Don't
again
even.
when you have teenagers.
Right. No, you don't get to sleep. What are you, crazy? No. I was on that sofa with one eye open watching the Late Show, waiting for them to come home, and they knew that they had to come in the house and come to see me and say goodnight. You live in my house, that's what you do. So there was no sneaking in, like, oh, these shoes, don't wake up Mom and Dad. No. So they knew my mother's going to be awake waiting for me. So, it really, in a way, helps them to be able to say no. It empowers them to be able to say no as well. I mean, there are so many techniques.
Yeah.
We could go on and on because they're there. And these have been scientifically proven.
And it's not just relevant for prescription meds and heroin.
It's for everything.
It's alcohol, it's tobacco,
Right,
it's
that's for everything.
e-cigarettes, which most parents don't even know are on the radar yet.
Yeah, what's the deal with like e-cigarettes? And there's also like the new place about like vape.
Yeah.
Well, that's an
That's
e-cigarette.
for
Vapor.
e-cigarette.
It vaporizes
Vaping.
a liquid in what looks like either a cigarette or looks like a pen sometimes. They look more like pens.
Yeah.
But basically, it's
a-
nicotine or it's marijuana, and you can't tell.
It's odorless. It's candy, can be candy flavored.
Really?
Yeah.
Wow.
And it is the new substance of choice.
For kids.
Starting in middle school in some of the
Right.
communities
Right.
that I've seen the data for.
Wow.
Right.
Yeah. So cigarettes, this country and the state has done a phenomenal job of, like, kids are just not smoking cigarettes
Like they
used
Right.
to.
Although
Phenomenal
I still
job.
like
That
go
message has
out
gotten
and I
through.
still see like driving down the street there's somebody hanging.
Sure.
around with
Well,
this-
you're still
I'm
gonna
like,
see, but it is a lot. This generation, much less than our generation at that age. But what they is doing instead is we're seeing more of the vaping, as you
Yep.
said.
Yeah.
The e-cigarettes,
And the trends,
electronic cigarettes.
the trend in e-cigarette use is astonishing. And I don't know if there were questions on the Burlington survey for e-cigarettes, or it wasn't part of that
it's
presentation.
It's going to be on the
Yeah.
2016. It was not on the 2012 or 14. So they have added that, I believe,
But
to the 2016.
well, it's just kind of become popular.
So, right.
The data I have seen for a couple communities in the Boston area has been like a quarter of high school students have used
Really?
e-cigarettes
25%.
Yeah.
That's
in the past 30 days.
wow.
Yeah.
Right. So that's consistent use.
Yeah.
That's not good.
No.
No.
And we do have a vaping shop just up the
Yeah.
road
We do.
now.
We do.
Yeah.
I saw
They just
that.
opened.
Yes, I do.
Yeah.
Yes. And so you don't know though, because it is not. There's no
Regulation. or-
real scent.
Oh,
You know,
okay.
in other words, you can't.
Oh,
Yeah.
You know what I mean? You can't tell if someone is smoking marijuana or smoking, nicotine and like a cigarette instead.
Okay.
You can't tell. So that can be problematic with your kids.
So, back to your curriculum. Is it like a printed curriculum? Is it just like
It's a
talking to parents?
It's a parent group that would get together.
Okay.
I mean, it can be done on a large scale or a small scale. When it's a small scale, sometimes that's a lot more fun because it can be more discussion and
like 3 versus 300.
Well, I wouldn't say 3, but 30 versus 300,
Okay.
we'll say. But I've done both. I've done it to both.
Okay.
So
I'm just using 3 as an example.
yeah.
'Cause
Yeah.
there's the 3 of us chatting
yes,
here.
right. You're right. Sorry. 1, 2, 3.
I watch my Sesame Street, which
Right.
is now,
But,
speaking
you know,
of our generation versus.
Right. But there's
Won't go there.
there's a lot of great ways that we'll be able to get the information out to parents
Yeah.
about things.
And the big
So.
thing right now is really just getting the word out that
Okay.
we have this group of parents starting. We have a small group who's really interested in help with the planning efforts. We've got a little bit wider group of people following our Facebook page.
We have
and
over
on our
100
email
people
list.
on the Facebook page.
I'm one of them.
Yep.
Well,
so that's a
great.
start, and that
Right.
through
Yeah.
our regular open community meeting discussions that we're going to begin hosting, we want to get parents in the room together so we can really start talking about this one-on-one. So this is parent-led, it's peer-to-peer. We have expertise in different areas that we'll bring to the table, but we also believe, and I know because several other parents have reached out, we have a lot of expertise in the community.
We do.
We've got neuroscientists, we've got physicians, we've got
Wow.
social workers, we've got
Right.
teachers.
Right.
I mean, there's an enormous
Wow.
amount.
Right,
of,
so we don't need to hire
No.
experts, to come in and talk to parents. We're here. We just need to pool
We are
our
the
resources. We need to
And-
pool our
and
resources.
this is our community.
Yeah.
And these are our kids, and they are going to go to these schools, and together they create the social norms
That's right.
of among all the peers. So
Right.
the health of my
Exactly.
kid
Yeah.
depends on the health of your kid and
That's
the health
right.
of your kid,
That's right.
because they're all going to go to school together.
Peer pressure is not going to go away.
Right.
So if we can have peer
Right.
pressure be pressuring
Positive.
in a
Positive.
good
Be
way.
positive.
Exactly.
Absolutely.
Exactly.
Okay.
Exactly.
Absolutely.
Now, I just want to throw this out there. It seems like much of your work will be on prevention.
Obviously,
Yeah.
yes.
Yeah.
Yes.
It's a lot easier
Yeah.
to prevent something than cure it.
Yeah.
Okay. Are you going to delve into treatments at all, or are you just going to kind of focus, because that's like a whole other,
Yeah, probably
Okay.
not.
Yeah, I think prevention is really where.
well, especially since you're starting
Well,
so
we
young,
do want
too.
we do want
Yeah.
to try to reach parents of students that are still in elementary school. So
Okay.
where most parents are not like you. Most parents
Most parents don't have PhDs.
Well, but no, most parents are more worried about whether or not the kids are trading their sandwich for a Twinkie until then
Oh, they're not allowed to
Well-
do that in elementary schools now.
Oh, they're not? Well,
no
you know what I mean.
sharing.
No sharing. Well, what I'm saying is that the focus, like when my daughter started going to the mall every Friday night, and I started becoming concerned about what's out there and what she is being exposed to. It wasn't until she was 13 or so, 14. We want to reach parents much earlier because problems can already start at 13, 14. We don't want to wait till there is a problem. We want to educate parents, empower parents.
So kind of nip it in the bud type thing, because you don't
Right.
want to, gee, why are all these water bottles?
Prevention is much
Yeah.
easier than a cure.
Now, will you just be focusing on parents, or at some point, either right now or in 5 years or whatever, start getting the kids involved in the training and to kind of work that peer pressure
That would
in?
be awesome to be able to do that too. Have programs for the kids as well.
I mean, in 5 years, I think the vision would be we have a really robust and active substance abuse coalition going on in this
Okay.
town. And we have parents working with the coalition and working with the schools, and the schools are working with the coalition, and the police department's all involved, and we're all on the same page. And
We would
kids,
network
the
it,
voice of
and then
kids,
absolutely.
and are part of that discussion.
Right.
Oh,
A lot of communities
that
that
would
I've
be-
worked with, which started out with the coalition and having these parent groups and that kind of thing, and then added the student piece
Oh, okay.
later. And I think that's an excellent idea to do that.
I think in the communities that I've worked on projects with and doing program evaluation for substance abuse prevention efforts, it feels like often they forget either the parents or they forget the kids. Not everyone's at the same table all the time, and that's kind of the weakness in prevention efforts in general, because you can only really prevent things when you have every aspect, every part that touches that problem at the table and working towards the same goal.
These problems are big problems. They don't just affect the schools. No. They don't just affect parents. No. They don't just affect the police department. Right. So you have to be able to access everyone.
Yep.
Everyone has to come to the table. So we do want to work with the task force, and we do want to work with the school wellness committee. And
I didn't know there was a school wellness committee.
Oh, yes. Gonna have a school wellness
See, I'm just
committee.
Starting to get into the whole school system,
right.
you know.
So you know,
I'm right there with you.
Yeah. So you know, we want to be involved with all of that, just you know, and connect with that, because it's the only way that you can solve a community-wide problem, is if the whole community works together.
It takes a village.
Right, and the task force had some really nice programs. I don't know if you remember, but we had the alcohol-free weekend.
Oh, I remember, on the Common, right?
Yes.
Free pizza.
Free pizza and music, and the message was for parents to pledge to abstain from alcohol for one weekend, which most parents, I don't know about you, but you know, we're not drinking every weekend. We're busy with our children, and there's family activities that are going on. But it is a reminder. It was set a week before the proms. So it was kind of a reminder for parents of older students. Now, this is a really good time to have a conversation about your expectations coming up with prom and graduation around the corner. And then for the younger students to see all these people around town with those buttons, I don't know if you remember, but the big red buttons. And
didn't remember they were red, but I do remember.
You know, that everybody, you know, that all these adults are wearing buttons, and these are all adults that are not going to be drinking this weekend, because kids don't, you know, they don't really think about that. They just think.
Well, my kids are like, I want a button too.
Of course, we had to make the small. We made the white buttons that said "Someone I Love" is alcohol free in Burlington this weekend, because the kids wanted to have buttons too, and
it probably would be, you know, a little scary if the kids were walking around, you know, 5-year-old.
Oh, I'm not drinking this weekend. Right. So you know, it was
this weekend.
This was a community. This showed kids that the community cares about them. And studies show that when kids feel that the community cares about them, they're going to make healthier decisions. They're going to make better decisions. We also reached out to the young adults. We had the Be the Designated Grown-Up was another program that we had. And we put these
what's that?
The stickers.
I don't remember that.
We had flyers that we stuck on all the pizza boxes on Memorial Day weekend. We did that, I think, 2 or 3 years in a row, and that was really to reach out, because the police department told us that the biggest place where kids are getting their alcohol is from older brothers and sisters buying for them. So we said,
is that still the case?
We need to reach.
You know?
Well, it was just a couple years ago, so I would guess so. Yeah, you know, and we had the high school students help us design. You know, let's design this flyer. What do you think it should say? And you know, get their youth perspective on that. So,
what would you actually read?
Yeah, you know, how do you want to say that? So they came up with that slogan of "Be the Designated Grown-Up," you know, and it was a great program, and we did use a lot of students for that.
Now, do you see, you know, where you sit now, do you see any of these programs kind of resurfacing, or?
Well, that's up to the task force. We're our own group, but we certainly hope we want to work with them. We've contacted, you know, people to try
so the task force still exists.
Well, no.
Okay,
I
no.
mean, if they're not meeting technically, I don't think that means they exist.
Oh, okay. That was just,
We're ready to
trying
attend
to-
meetings though with them.
Right.
So.
In other words,
Yeah,
the task force is people from all the different
different-
sectors.
okay.
So we have communicated to the heads of all the agencies and
Let's
said, hello.
reestablish
Yeah,
this
when's the
task
next
force.
meeting? We
Okay.
want to come to a meeting.
Yeah.
We want to be involved. So we're hoping if we keep asking, they'll eventually.
Yep.
Hey!
Yeah, and it is normal to see in communities to see the interest in this thing to wax and wane, and I know that, but we're going to get them interested in getting going then, because there have been a lot of great things that they've done.
Okay. Well, I'm also thinking with all of these wonderful things that you hope to rejuvenate or, bring forward again, printing out flyers, having free pizza on the common, making buttons, who pays for all this stuff?
Oh, that's a really good question. That for the task force anyway, the town allocated $2,500 every year for us. Most communities apply for grants. I mentioned that federal grant money is given to each state, and then the states allocate it, so you apply for grant money. And I would love to see Burlington be able to do that. Right now, if you're asking about Burlington Parents Stand Together, we don't have any money.
No money.
We have no money.
No.
Well, I'm
we
just
just
wondering,
started.
are you going to do a bake sale and just not sell brownies, or
Kind of brownies are you
a
selling?
bake sale,
No.
but I like that. And you bake, right? You mentioned that.
Linda, you do. You told us about your baking technique and
I
talents.
could do that, just not in the next 2 months because my kitchen is going to be gutted.
Right.
I hope.
But certainly these
And I won't
are
bake brownies.
things that we're going to talk about. If the task force is not going to meet anymore, then does that mean that $2,500 is up for grabs? I don't know. I mean, could we possibly ask the Board of Selectmen to allocate some funding for us instead, or I don't know. We don't know that yet. We're just literally getting started.
Yeah. But we'll be using the library as a meeting
Yes,
space
our first
to
open
convene.
meeting
Yeah, I
for
was gonna
parents
ask
is
you if
coming up Monday, March 28th.
Yeah, the last Monday.
The last Monday in March at 7 o'clock at the Burlington Library, and all parents are welcome, all ages. Doesn't matter how old your kid is. Come on down. Let's start the discussion. Let's
have the different perspectives from the parents as well as the kids, and
let's get going on this.
Yep.
Okay.
Talk about
The more the merrier. Come
Talk
on
about it,
down.
yeah.
So at this meeting on, was it March 28th,
March.
you said? I have a short-term
28th,
memory.
yep.
What do you hope to accomplish? Are you hoping to, establish a regular meeting schedule?
Yes, I would
or are
love-
you
yes, I would
hoping
love
to
to do
figure
that.
out which direction do you want to go in? Is there a direction?
I think we
Do you
know.
wanna-
I think we know the
Okay.
direction. I think we want to let parents know who we are, what we're doing.
Okay. And they can
Um,
like you on Facebook.
Yep.
And they can like us on Facebook and email us so they can be in our email listing, and we can keep them
Okay.
informed on what's going on, and set up a meeting schedule. And some of these meetings we may have an educational piece to it. We may do a presentation. We may have, like you said, we have a lot of parents that bring expertise to the table, and we can ask them to talk about different things. So some of the meetings may be more discussion and project oriented, and others may be more educational, but that's basically what we want to do.
And you
Yeah.
know what? We're out of time.
And there you
Oh,
go,
wow.
ending on a perfect note.
So we'll check you guys out at the library on March 28th. And I definitely want to thank both of you for coming tonight and filling me in
Thank you
and
for having
filling
us.
in our audience.
Great.
And I do want to thank everyone at home for tuning in this evening. And I hope you found our discussion as informative and inspirational. There's hope. There is hope.
Always.
Always hope. So thank you very much for tuning in, and have a wonderful week. Good night.